Authorities in the U.S. and Mexico have asked the World Health Organization to declare a public health emergency of international concern over a deadly outbreak of fungal meningitis. The CDC is monitoring some 200 Americans who traveled to two medical clinics in Mexico for cheap elective surgeries and may have been exposed. At least 4 people have now died.
With more on this and the other big medical news of the week, we are joined by our resident medical expert, Fox 11 medical contribute, board certified ER doctor Michael Daignault. Dr. D, good to see you.
Good evening.
This is scary stuff. What's the story here?
So, like you mentioned, they just declared an emergency, or they asked the WHO to declare an emergency, and so we're monitoring people. Mostly have come from Texas, but we're also concerned about people from California traveling to these clinics in Mexico for elective surgery, like plastic surgery, things like that. And the concern is that from the epidural, which is the procedure to numb the area of the body before the procedure, that it was been linked to fungal meningitis. So fungal meningitis is very concerning. It can lead to inflammation, swelling of the brain, sepsis, and even death. And so we're trying to put out the information here that if you've gone to one of these clinics in the last few months, you need to get checked up, even if you don't have symptoms.
Okay, so we have that information to throw up on the screen, so I think we can do that. This is in, as you mentioned, the epidural in Matamoros, Mexico, Riverside Surgical Center, and the clinics K through 3. And again, I think, say that again, even if you don't have symptoms, what should you do?
Right, so most of the time, a lot of these patients developed a headache first, but even if you don't have symptoms, it's important to go to your nearest emergency room and be evaluated for fungal meningitis, just because of how severe the complications can be.
Wow, okay. Now to this, also big news here. A meta-analysis has found the risk of the heart condition myocarditis among adolescents aged 12 to 17 after an mRNA COVID vaccine is rare, no higher than after other vaccinations. The post-vaccination risk also reportedly lower for that cohort than the risk following an actual COVID infection. What's the takeaway here?
Well, I think you nailed the 2 take-home points right there. And I mean, I think the concern, especially from parents at the beginning of our vaccination effort, was the risk of myocarditis, specifically for adolescent males in that age range of 12 to 17, developing myopericarditis, which is inflammation of the sac that surrounds the heart. So this was a meta-analysis, multiple studies, multiple countries, which showed that the risk for this is actually very low and less than from other vaccinations, and most importantly, less than the risk of myocarditis from getting COVID itself.
So there was so much reporting about that, so much conversation on Twitter. Don't get the vaccine because of myocarditis, but you're saying the actual science, the actual facts say that really wasn't true.
Right. I mean, the advantages, the benefits of the vaccine far outweigh the risk of this. I mean, it's clear now with the science and the studies.
Yeah. One more story we want to sneak in. The CDC says that eligible infants, who are aged 6 months to 6 to 11 months, should receive an extra measles, mumps, and rubella vaccine before any international travel this summer amid rising cases of the contagious disease this travel season, including 2 confirmed cases in Fresno.
Right. Yeah, this is concerning. So the reason the CDC put out this alert is because 90% of the measles outbreak currently in this country are related to international travel, including the outbreak in Fresno that you mentioned, and it's mostly in unvaccinated infants. So the risk of severe illness from measles is, you know, about 1,000 cases, 1 to 3 of those could be fatal. It's also a very highly contagious disease. One person with measles can spread it to 9 to 10 others. Wow. And so what we're saying is normally when you get your MMR vaccine, you start at 12 months, then you get your second one at 4 years. What we're recommending parents is that if you have infants between 6 and 11 months, to get that first vaccine at that point before you travel. And then when you come back, you still have to get the 2-dose primary series. And for the rest of the adults, once we've had those 2 doses, we don't need any more boosters or shots after that.
Wow.
All right, parents, listen up. Dr. D, he is here to inform us all, keep us healthy. All right, thanks so much, Doctor.
Thank you.